Hello and good day, everyone. My name is Dr. Tiwa, and you're welcome to another episode of the Direct podcast. Today, we're going to talk about a very, very common and highly prevalent medical condition in Nigeria, which is called goiter. This condition has been known to affect and significantly impact a lot of lives in Nigeria. So, today, we're going to speak about why that is, what can be done nationwide to prevent it, as other countries have done, things to look out for, what exactly is affected, and that thing that is affected, how does it progress in our body, showing the effects that it does in our body, as well as the prevention, management, and things to look out for. It seeks out to be an informative episode. Please stay tuned as we dissect goiter today. So what is goiter? Goiter is a condition where your thyroid glands, which are located in your neck below what is called an Adam's apple, is when they increase in size. When there's an abnormal enlargement of the thyroid gland, that's where we get the word goiter. A lot of goiter that we see in Nigeria, for instance, are usually dramatically increased. For instance, where the neck is seen to be swollen. Now, your entire thyroid gland can grow larger as the ones that are normally seen in Nigeria, or it could be one or two small lumps. So a lot of people could always make the assumption where, oh, my neck is not swollen, so I don't have goiter. That may not be correct, because even having swollen lumps in your throat under your Adam's apple can also be goiter. These are usually two different types, or even three different types of goiter, which we are going to explain as we move on. Nigeria always will face this kind of issues because we do not have iodine in our salts or in our condiments that we put in our meals. So we usually have the prevailing problem that leads to goiter, which is iodine deficiency. Now, thyroid gland is a small butterfly-shaped endocrine gland below your Adam's apple. It produces the following hormones. One hormone called the triiodothyronine, T3, and another hormone called the tetraiodothyronine, which is the T4. These hormones play very good and important roles in our body, especially with our metabolism, with control of our blood pressure, control of our mood, control of our excitability, control of our body temperature, pulse, and heart rate. So these hormones are very important. Now, goiter itself impairs these hormones, leading to an irregular amount of these hormones being produced in your body, either through hyperthyroidism or through hypothyroidism. Now, what are the types of goiter? I'd mentioned it before that types of goiter could be differentiated regarding size. We have one, simple diffused goiter. This type of goiter happens when the thyroid gland swells and it is smooth to the touch. Then we have nodular goiter, the one I talked about that is like small lumps in your neck. So that is a way to differentiate goiter. Another thing is multinodular goiter, where there is multiple nodules of swelling in your neck. So there's nodular where it's one node, and there's multinodular where it's multiple nodes. Now, it can also be classified based on the thyroid hormone level. Now, I already spoke about how goiter could lead to increase in hormones of thyroid, that's hyperthyroidism, or decrease in the thyroid hormones, that is hypothyroidism. Now, there is toxic goiter. It usually differentiates goiter too. So there's toxic goiter. This usually happens when your thyroid gland is enlarged, and now it leads to increase in thyroid hormones, that is T3 and T4. And you know they already control your heart rate, your pulse, your blood pressure, your mood, your excitability. So imagine when you have toxic goiter where all those processes are increased. That's where you have toxic goiter. Now we have non-toxic goiter where there is also an enlarged thyroid, but the thyroid hormone levels are normal. That is called the euthyroid. That is a non-toxic goiter. We call it non-toxic because it does not affect the processes of the body negatively. So we call that a non-toxic goiter. Now, who is likely to be affected by goiter? Because of the state of how Nigeria processes its meals, anyone can get goiter. It is 4 times more likely to affect a woman at birth compared to people that are male, assigned male at birth. Now, your risk of developing goiter also increases with age. That is, it is very much common with people that are aged 40 and above. People that also have the following conditions can develop goiter. People that have obesity, insulin resistance, and metabolic syndrome. So when you say insulin resistance, you usually talk about diabetes. So patients that have diabetes or patients that have metabolic disorders, like maybe if they have things like peptic ulcer disease, for instance. We also have patients that have pregnancy, that have had pregnancy or are experiencing menopause. Medications also can cause you to be susceptible to goiter. Medications like lithium, amiodarone, they increase your risk of having this goiter. You're also at risk of having goiter if your head and neck is exposed to radiation treatment. A family history or family medical history of goiter can also lead to you being at risk of having the same condition too. So what are the symptoms of goiter that you should look out for? Like I said, it's a swelling on your neck. So during medical examination, it can be noticed that you have a swelling on your neck. So that is the telltale sign or telltale symptom that usually occurs in patients that have goiter. But as I've said before, we have different classifications of goiter, the non-toxic, the toxic goiter. So if you have a non-toxic goiter, the swelling alone would be the only symptom you would have. But if you have a toxic goiter, you would have some symptoms. Now, that is if you have an underactive thyroid, for instance, which is hypothyroidism, you would have symptoms that are consistent with having hypothyroidism. That is, you would not be able to tolerate cold. You would have dry skin. You would be feeling a lot more tired. You would also feel like you are increasingly likely to sleep off. Now, when you have an overactive goiter or overactive thyroid, that is when you have hyperthyroidism. That's when you now have increased tolerance for heat. Most of the time, hypo and hyperthyroidism are opposite in terms of the symptoms that you would have. So sometimes you might get confused that, oh, do I have goiter or do I not have goiter? The thing is, goiter is very fluid in terms of its symptoms. If you have an underactive thyroid where you have hypothyroidism, you would have similar symptoms to that. And if you have an overactive thyroid that has hyperthyroidism, you would have similar symptoms to that, where you would have frequent bowel movements, your menstruation patterns would be all over the place, you'd feel more irritable, more nervous, you would have excess sweating also, and an increased appetite. So you would have to look out for these things when it comes to symptoms for goiter. Children, though, with hyperthyroidism have the following symptoms. They would have a rapid increase in their height. Their bone growth would be way higher than what is expected for a child of their age. Also, we have what is called an obstructive goiter. Now, when it's an obstructive goiter, this means that the goiter is increased to a point where it is now affecting the neighboring organs. That is, it is maybe obstructing the airway where it's difficult to breathe, or it's obstructing the voice box where it's difficult to speak. If we do not take in enough iodine, then our thyroid gland starts to think that, oh, the thyroid gland does not start to produce enough hormones. And once that happens, the pituitary gland thinks that, okay, what's wrong? Why is the thyroid gland not producing as much hormones as possible? That mechanism is called the negative feedback mechanism, where once one part of a system is not working, the part that produced that second part of the system thinks it is not doing enough work. So it tries to compensate for that one that is not working well. So once that one does that, the second one starts to increase in size. This is uncommon in the United States because there is iodine in their table salt. But in Nigeria, it is particularly problematic because we have many regions with iodine poor soils, and people don't really have constant access to iodized salt or iodine rich foods like seafood, dairy, or grains. Now, what are the causes or complications that could come about when it comes to goiter? We have things like Hashimoto's disease, which is an autoimmune disease, causes the system to attack its healthy tissues. Now, those damaged tissues of our thyroid, they don't produce enough hormones, leading to hypothyroidism. And when the pituitary gland detects this decrease by the thyroid gland, it prompts the thyroid to create more hormones, and that thyroid becomes enlarged. It's the same process with how iodine, if iodine isn't taken enough, that helps the thyroid gland, the pituitary gland always tries to make up for it. Then we have what is called Graves' disease, which is also another autoimmune disorder, where protein that mimics a vital hormone that the thyroid gland produces, that protein then prompts the thyroid gland to overproduce thyroid hormones, leading to it to swell. We've already mentioned pregnancy. Thyroid cancer, although uncommon, can also cause goiter. And also we have inflammation. This is called thyroiditis. Now, thyroiditis is inflammation of the thyroid itself caused by another autoimmune disorder, whether bacterial or viral infection. Okay, so how do we prevent goiter? Now, because of the nature of what causes goiter, which is iodine deficiency, a nationwide iodinization of our table salt would be a crucial step taken to prevent this condition in general. Another way to prevent goiter is to avoid goitrogenic foods. What are goitrogenic foods? We have things like cassava, corn, cabbage, soybeans, peanuts. These interfere with the absorption of iodine by the thyroid gland, which can cause goiter. So limiting the consumption of these foods would help in making sure that we reduce the goiter level in Nigeria. So because of how it is dependent on iodine deficiency, public health education is very important. People need to understand why iodine is important for their meals and how they can obtain it, where they can get it, why it is very nice for them to get it for their family, to get it for themselves. And for areas where iodine is scarce, iodine supplements should be made readily available for them to take. Lastly, regular medical screening, especially in areas that are known for high iodine deficiency. Going for regular screening, especially for people that also have nodular or multinodular goiter that is not readily visible from just looking at their necks. Doing a regular screening would be important for those sort of people. In conclusion, goiter remains a very significant issue in Nigeria, especially with the fact that we have a lot of areas that do not have access to iodine, and also the public health in terms of information that people need to get about the importance of iodine is not readily available to everyone. So we have to understand that we have to seek out this information and be proactive in this management to make sure that we do not get goiter by making sure that we get iodine in our meals, especially in places that have iodine rich areas, and for places that do not have access to iodine, making sure to go to their healthcare provider to ask for the proper iodine supplements that can help them prevent this medical condition. And that brings us to the end of another episode of Seco Direct. I remain your host, Dr. Tiwa. And if you have any questions for us or any comments that you want to pass regarding this episode, please make sure to comment below. Thank you very much. Until next time, I'll see you around.